For me today, the biggest bang for your buck presentation stream was the HPV and anal cancer stream, and for me, this is a very important emerging area. What we know is that men who have sex with men are at 20 to 40% increased risk of developing anal cancers, and these are HPV related. Men who have sex with men who are HIV positive are a 100-fold risk of developing anal cancers. Again, these are the vast majority of the anal cancers are caused by HPV, in particular HPV 16. HPV 16 is preventable through vaccination, and we really do need to move towards getting guys to consider getting the HPV vaccine. And evidence that was presented earlier in the week has basically said that whilst it was believed that HPV vaccination wasn't very effective beyond the age of 25, evidence is that older gay men are naive to HPV 16, so there is a good chance that vaccination may work in those cases. Now, I have always been a big advocate for doctors doing their own anal swabs. That is, that if I have a patient coming in, I will do the swabs. I know some people choose not to do it because of embarrassment or the patient comfort, but for me, it's an important time to have a look at the bum. I pick up a lot of anal warts that way. I've picked up numerous syphilitic chancres that way. And today's talk has absolutely changed my practice. And now that we know that these men are at high risk of anal cancers, and we need to start detecting them. If they're beyond 2.9 centimetres in diameter, this is a really bad outcome, and it involves significant treatment, including surgery, radiotherapy, and chemotherapy. However, if they are diagnosed 1 centimetre or less, it may mean that they don't need chemotherapy, they don't need radiotherapy, and the surgical removal is very localised. We're trying to aim before the cancers get to the level of the anal sphincter. Now, these cancers are developing at the dentate line, so that's where you've got the squamous epithelium meeting the columnar epithelium of the bum. So it's not like it's difficult to access that area with the tip of a finger. So what I've learned today is that we really need to be doing a digital exam, checking the bums of, firstly, all of our HIV positive patients at least once a year. If you don't stick your finger in, we could very well be putting our foot in it, and it's best to detect early rather than wait for somebody to have symptoms. And also for my gay patients who are not HIV positive, I will talk to them about why it's important to consider getting this done as well, and the recommendations would be every 1 to 3 years as well. So I think it's important that we consider to start screening our gay patients or men who have sex with men for anal cancers. We already know that they're at high risk and that early detection can make a significant difference. So I personally would urge my colleagues to consider doing a DRE as part of a routine sexual health screening every year. Probably not necessary every quarter, but I do think it's important that we have the discussion about, one, we need to screen for anal cancers, and two, we need to vaccinate against anal cancers. This particular stream today has definitely, absolutely changed the way that I will practice as a doctor, and I will continue to advocate and speak forward that we encourage our patients to consider all that they can do to prevent anal cancers as well.